Everyone to the March Health and Wellbeing Board meeting. My name is Philip Glanville. I'm one of the co-chairs for the Health and Wellbeing Board. This is a hybrid meeting where some people will be presenting and attending in person, but some people might be presenting and attending through Google Meet. As people are hopefully used to, we ask people to mute themselves unless speaking. For people attending in person, please do raise their hand if they want to contribute or raise a question. Please don't use the chat function to do that unless you're having any problems, and you can use the hand raising function online. I am in that meeting, but I'm also obviously in the chamber, so please do try to attract my attention if I'm missing you to bring you in. And if there are any problems with IT, you can also use the chat function. In the room, we have myself, Councillor Chris Kennedy, Cabinet Member for Health and Adult Social Care and Community Sector, Susan Masters from HCVS, and Councillor Williams, who is currently running late. That would have made us quorate physically, but Councillor Williams has yet to join us, so we're just going to proceed on that advisory basis. I've got apologies absent from Deputy Mayor Bramble, James Conway, BC Youth Commander, Francis Haste, Stephen Haynes, Raj Radia and James O'Neill. Are there any other apologies? Helen Kennedy.
Helen Woodland for lateness.
Helen Woodland for lateness, and Raj is here online, which is what I'm sure he's about to tell me. So welcome. And there are colleagues obviously online as well, and thanks for coming, Raj, online. So we'll remove your apologies from that list. Now, in terms of sort of housekeeping and welcome, while James Conway, who's the BCU Commander centrally, is BCU, did join us at the last meeting, he wasn't a full member of the board. So our aim is to appoint him to the board. But I don't know that we can do that if we're not quorate. So we may come back to that as an agenda item. In terms of additional direct declarations of interest, are there any that haven't already been recorded? No. Thank you. So then we're on to the draft minutes of the meeting of Thursday 26th. We can't agree those because we're not quorate. So I will park those. It is probably worth looking at the action tracker though under item 5. So if we can go through that. I don't know, Donna, do you want to go through that with us or?
Yeah, there was only one action from the November meeting last year. Susan from HCVS provided us with their cost of living insight report following the November meeting, and I believe Peter distributed that to all members last week as well. So that action looks like it's not complete on the published papers, but it has now been done. So there's no other outstanding actions.
Great. And in terms of the circulated paper, it's for information, but I'm sure Susan would value contributions and feedback from the board members that have received it. I certainly read it during the pre-meet. Is there anything else, given it's your paper, Susan, you'd want to just sort of add?
No, I mean, that would be fantastic. I was just very aware that Healthwatch had sort of presented from a resident's point of view. And just in terms of the voluntary sector, obviously we deal with large numbers of residents and also residents ourselves. And I felt it would sort of round out that picture of how the borough is being affected by the cost of living crisis.
Thank you. It was, yeah, food for thought for myself and certainly Councillor Kennedy and Sonia in terms of that and how we take that sort of forward. Are we all happy then with the actions tracker? And obviously there's previous actions that have been closed in the main set of documents. In terms of questions from the public, we haven't had any submitted for this meeting, so we can move on to Cathal and item 6, which is Hackney Council's Eliminating Violence Against Women and Girls strategy. The report is attached. There's going to be 10 minutes presentation from Cathal and then 5 minutes for questions. Cathal, if you, as presenting, just sort of shape what you want from the board, that would be really useful. And then we can have that discussion afterwards. And obviously very welcome and timely that you've joined us this afternoon. I'll hand over to you.
Okay, thank you very much. Okay, so hopefully everyone can see these slides okay. So thank you for inviting me to the board today. I'm mainly presenting for information purposes, but I'm happy to take any suggestions or comments afterwards, of course. So I'm going to be speaking, as Mara said, around the Hackney's Eliminating Violence Against Women and Girls strategy that takes us from 2022 all the way up until 2025. In summary, the strategy addresses all forms of violence against women and girls and also all domestic abuse. It was approved by the Cabinet on the 12th of September, and there are 4 priority areas. These are in line with national and London strategies. The 4 priority areas are preventing and reducing violence against women and girls, supporting all victims and survivors, holding perpetrators to account, and building trust and confidence. The oversight of the strategy takes place via the Violence Against Women and Girls Strategic Board, which meets quarterly and which involves a wide representation of partnership agencies. Also, there's a partnership approach taken to the delivery of the strategy via the Violence Against Women and Girls Operational Group. So what I thought would be useful for today's presentation would be to draw on those areas of the Hackney's Health and Wellbeing strategy which directly or most directly intersect with the Eliminating Violence Against Women and Girls strategy. So as I went through the health and wellbeing strategy, there were some key areas that I felt overlapped most keenly. So under the policy context arena, improving mental health and supporting financial security, and also under the ways of working part of the health and wellbeing strategy, collaborations and partnerships and making the best of community resources, I felt were most intersecting with the violence against women and girls work that we're doing. So if I take the first of these, in terms of improving mental health, we know that violence against women and girls and domestic abuse has a very significant effect on the mental health of survivors and their children, who are also victims of domestic abuse when living in households in which domestic abuse occurs. So if we address violence against women and girls and we address domestic abuse in all its forms, then we can be sure that we will be having a positive effect on the mental health of residents. There are 2 key things I wanted to draw people's attention to, in addition to the generic benefits, as I've spoken about, in terms of reducing domestic abuse. So in Hackney, we have said that we want, as part of our strategy, for children and young people to exhibit positive behaviours and attitudes relating to gender. And this includes, of course, non-binary, trans and non-conforming gender. So one of the examples that I've mentioned in the report that I submitted is that in Hackney we have developed and are rolling out specific tools for practitioners such as teachers, youth workers, members of faith groups to deliver with young people to help screen for problematic attitudes around gender and relationships. And then there is a suite of intervention tools that can be delivered with the young person in partnership with them to take a trauma-informed approach to address any issues that they've had, and also to hopefully improving their perspectives on gender and relationships. So that's something that we've developed within Children and Family Service, and we're rolling it out in wide partnership with colleagues across the piece. And the idea is that if we intervene at that early stage, then we can mitigate against those ill effects of on mental health as domestic abuse is perpetrated later in life. We also know that when children and young people have been harmed through violence and abuse, they need an opportunity to heal, and that opportunity to heal will mitigate against them experiencing future harm or from causing harm to others when they are in adolescence and adulthood. So one of the things that we're working on as a partnership, particularly with health colleagues, is to try and build capacity in the wider system to enable young people who've been traumatized through domestic abuse to obtain the therapeutic interventions that they so dearly need. For example, the Homerton NHS Foundation Trust has increased its capacity within its talking therapies provision to address the very specific harms that domestic abuse causes and to help people along a therapeutic journey. That work, I should say, is ongoing. We don't yet currently have enough capacity in the system to meet demand, but it's a piece of work that I know that health partners are committed to. Another area of intersection is around supporting greater financial security, as mentioned. So again, we know that domestic abuse, when it occurs, has a very disruptive and negative effect on victims and their children in terms of their income, employment security, and housing. Often victims feel that they need to leave their place of work, or part of the domestic abuse involves stopping them from working. Also, they often feel that they need to leave their homes in order to be safe. So if we address domestic abuse, then we enable people to live safely in their homes, and we also enable them to be safe in their place of work. And so we're committed to stopping their workplace being an area where perpetrators of harm can target them. So the first area of our violence against women and girls strategy that overlaps with this element of the health and wellbeing strategy is that we've committed ourselves as a partnership to saying that the housing needs of victims and survivors are prioritised. So there's a large span of work being done by the council around domestic abuse and council tenants, and also anybody presenting as homeless to the council. But one specific example I've picked for today is that we are in the process of developing with registered social landlords a protocol around domestic abuse. And this is to address the very real issue that we've seen, whereby those living in RSL properties who are experiencing domestic abuse often haven't had that consistency of support that they need, and thus end up presenting as homeless either to Hackney Council or to other councils. So we're committed to addressing that, and RSLs have shown and demonstrated that they also share that commitment. So we're working closely with them to try and make a real difference to victims and survivors in RSL sectors. The second area of our strategy is that we've said that employers will support victims and survivors of violence against women and girls and domestic abuse. Hackney Council, I think, has a very strong record in how we have set out our commitment as an employer to employees, that if they are experiencing domestic abuse, they will be supported by the council as their employer, and that action will be taken to make sure they're safe in their place of work. I want to expand that so that all employers in Hackney, in large or small settings, are equipped and confident in supporting victims, survivors of domestic abuse and any form of violence against women and girls. So we're working with colleagues in the council to try and roll out to the business sector across the borough training and material that will equip them to ensure that their workplaces are safe and supportive for all members of staff, and that anybody in their businesses who's experiencing domestic abuse can readily be signposted to appropriate support. That will be a big piece of work. It's at its relatively early stages, but as a direction of travel, I think it will benefit people in a very real way. So the other areas of intersection are around ways of working. So I felt that our strategy intersects quite well with the collaboration and partnership commitment, especially, and the neighbourhood element to that, and also making the best of community resources. So our strategy has said that all agencies across the partnership need to understand and work to an agreed casework pathway when addressing all forms of violence against women and girls and domestic abuse. So some examples of the work we're doing in that direction. So we're working closely with Hackney CVS, faith community groups, to promote awareness and collaboration. So again, that anybody who's experiencing domestic abuse, who needs help, is able to be identified as being in need of help and signposted to the appropriate service. We in Hackney have taken the lead in designing and implementing innovative protocols. For example, the intergenerational abuse protocol that Hackney has piloted, and as far as I know, we're still the only borough in the country to have this, which is specifically designed to protect those who are vulnerable and older from abuse within their families. So that type of approach that we're taking, I hope, is pulling the partnership along in terms of how we respond to domestic abuse when it happens and those who are vulnerable to harm. We lead as a council through example on a safeguarding approach to domestic abuse. The council itself is a provider of domestic abuse interventions to a large number of victim survivors in Hackney. And we take a very robust approach, and that, I think, helps set an example that other agencies can emulate. We are in the process of developing a unified partnership casework pathway for all violence against women and girls, so that whatever the form of violence against women and girls that occurs, everybody in Hackney, whether a member of the public, private sector, or statutory partner or community group, all will know what to do, how to get help, and can follow an agreed pathway to get that help. We're also taking forward place-based working and co-location so that we're more directly embedded into the neighbourhoods that we serve. We have the development of the family hubs as a really positive step in terms of how we can put our staff out there in the community and be much more integrated at a local level and have that closer relationship with our neighbourhoods. So I'll try and rattle through the next ones more quickly. The other elements of intersection here are that we've committed ourselves that the Violence Against Women and Girls Partnership will foster a learning culture that encourages good practice. So as a council, we provide a large amount of training. We'll be providing more and more over the next year and a half to partner agencies. And again, to all affiliates of Hackney CVS will have access to this, as well as faith and community groups. Also, we promote as a council training provided by other specialist agencies and local agencies in particular areas of domestic abuse or violence against women and girls. Related to that is 4.4 of our strategy sets out our commitment to ensuring the provision for services working with all victims and survivors, male, trans, non-binary, Black and global majority, or those who have unresolved immigration status, as well as any group within the community that's identified as not having their needs met. So we are promoting anti-racism in violence against women and girls. We've signed up to the national charter around that, and we have committed ourselves to providing and promoting support delivered by agencies run by and for the groups that they support. So specific ethnicity, cultural, linguistic, or gender-based groups. The council is committed to promoting those and supporting them. So I'm happy to take questions. Apologies if I've gone over, and I'm happy to take any questions or feedback.
Thanks very much, Cathal, and a really good detailed presentation, and recognise that it's also International Women's Day today, and while I'm not defining women by the experience of domestic abuse or violence, I think it's a timely discussion to be having this afternoon, given the impact it has on people's lives. Councillor Vagina Thomas, you're clearly the political lead for this work, and I know I've done a tremendous amount in this space, both at the council and beyond. Do you want to come in? And then I see Chris's hand. Councillor Vagina Thomas.
Thanks very much, Mayor Glanville. Thanks, Kaha, for the presentation. I've asked this to come to the Wellbeing Board because I think violence against women and girls is a major public health problem and violation of women's human rights, that it is important for us as a health and well-being board to see how we addressing violence against women and girls. We know that violence can negatively affect women's physical, mental, sexual, and reproductive health. And to see the way we are tackling it, in particular partners to understand the referral pathway and some of the training we have for or locally and for partners. So that is why I asked this to come here. I'll stop there. Sorry, ma'am, off camera because I'm not feeling too well at home. Thanks, Mel Glanville.
Thank you, and thank you for urging it to come here. It's really important, and do get well soon. So, Chris.
Thank you, Chair, and thank you, Cathal, for the report. I'm aware that we've, in the past, won quite a few awards in the Homerton for the work around identifying domestic violence and the referral pathways. And obviously, COVID has changed quite a lot, and I just wasn't aware whether the Homerton and NHS partners have taken the opportunity to again look again at how we can continue to build on that really successful work. So much of the COVID has disrupted things. I just wasn't aware whether we were able to give an update. And I think one of the areas that I was very interested in when we were re-specifying some of the public health investment in domestic abuse and the training was actually around community pharmacists. I think there may be some work that Bristol University have been looking at as to whether there can be the IRIS model expanded to include other settings, but I don't think that there's a particularly full update from our NHS partners. So I just wondered whether there was an opportunity for us to look again at whether they could give us a little bit of an update on what's happened post-COVID to build on that excellent work and the award-winning work that the Homerton had done previously.
Thanks, Chris. Just on community pharmacy, Raj has got his hand up, so I'm sure we can go across to that. I did just want to build on what Chris had said about the Homerton, Cathal, and colleagues on the call, thinking about opportunities to obviously detect, work with people at a moment when change is possible. So there's obviously an A&E interaction, the sexual health interaction, and then the Pause project obviously was connected to the Homerton as well, thinking about people involved in sex work. So just to sort of bridge and add to what Chris has already said, Raj.
Thank you, Philip, and everybody. So just to give you feedback on community pharmacy's role in terms of domestic abuse, I think during 2021, when we had the pandemic and the lockdowns, there was an initiative the Home Office set up with community pharmacists. It's called Ask Any, and any person that was domestically abused, there was a potential for them to come into community pharmacy and make it a safe place, especially in their consultation rooms, where it's in a place where we can then give them help and support to do that. So again, I think there are almost 5,000 pharmacists right across the UK that have done that. And I think that the number of pharmacists in Hackney that have also signed up to that as well. And I also want to share a personal issue that I had personally with a member of my staff who was domestically abused. She was with me for 6 years. Unfortunately, she left, and I think she didn't find the courage to deal with what had gone on. But it was quite challenging for me as a owner of a business, but also thinking of safeguarding, and I was looking out for her. She was out, number of weeks she was not at work, and when she did come back to work, you could see the bruises on the face and things like that. That was really frightening and scary, but it was quite challenging how to deal with that. Trying to help that member of staff. Unfortunately, she left work and she resigned from her place. But it does happen. I'd never expected that to happen within my workplace. So again, I think it's a fantastic idea that if we can be supported what to do. I did all the right steps, contacted the police, also contacted safeguarding adults. But obviously she was not willing to take anything forward. But yeah, so from my perspective, the community pharmacy, this is where people access health. We're here to help, and I hope that this report is quite timely in a way, what's come through. So yeah, we're here to help. Thank you.
Thank you, Raj. And obviously that's a very vivid lived experience that you and your staff have had, as well as that more strategic picture. Mark.
Hi, and for those who don't know me, Mark Carroll, Chief Executive of the Council. that was very good and really interesting. And as you and then Councillor John Thomas drew out, the relationship between this work and health and well-being is really important. The question is what impact do we think we will have if our strategy is successful? What are the metrics that we're using to be able to say, specifically in the health and well-being space, what are the health and well-being metrics that we would look to see a difference of? It'd be really good if we start thinking about metrics and targetry a bit in these conversations.
Thanks, Mark. So people may not have fully heard all that, but a question based on, if we were successful within our strategy in the context of health and well-being, how would we measure the impact and know whether we were successful? So I'm going to come back to you, Cathal. I don't think the Homerton are on the call unless I've misjudged colleagues. I did just want to really highlight, as you did on the introduction, the intergenerational work. And how pioneering that is from a Hackney perspective. I think the work with men and breaking the cycle as well with young people. I think it was 2 elimination of violence, 14-day, 16-day event where we did it with Young Hackney and talked about young people and young people from homes where domestic abuse had taken place and how we're working with young men from those homes. So again, really important and really powerful. My 2 questions were, what relationship, if any, has been established with the Money Hub to try and support people and get that help really instantly at the point of crisis, so they can take those decisions to potentially access services and maybe move on. And then also you mentioned wanting to work with business, and Raj has talked about that as well. The relationship with the Hackney Business Network, and I know we've got really strengths in Hackney nights around violence against women and girls, but that's sometimes about, it has felt to me in terms of how we've articulated it, about making the nighttime economy safe for, rather than thinking maybe about the industry and the safety of staff and looking at that. I'll probably stop there, and thanks everyone for their questions and contributions.
Oh, and would you like me to respond to some of those, or is there time? Or
if you can,
sure.
I appreciate there's a lot there.
Okay.
Maybe a brief sort of roundup, and then taking it away and coming back.
Absolutely. Okay, so I'll try and start at the back first. So in terms of the Hackney Nights work, so I work closely with Samantha Mathis, the late night levy manager. We do provide training on domestic abuse as well as that nighttime economy aimed at customers and patrons. So there is training that's being delivered to businesses within that sector around domestic abuse recognition and response for staff, as well as if they see it happening in customers. That's a pretty new development. I haven't made contact with the Money Matters yet, so that's something that I can follow up. In terms of metrics, so the Violence Against Women and Girls Action Plan does set out a number of targets and indicators. I think there is definitely scope, though, for more health-related metrics to be included in that. So that's something I can definitely take up with our health partners. I think that's obviously a good way forward. And building on what Chris had said there, so just to expand, so Public Health, CCG, have funded our service to deliver partnership training to expand the capacity to recognise and respond to domestic abuse across Hackney and the city. One of the key areas to look at is the health sector. So we already work very closely and well with the Homerton, but also with East London Foundation Trust, and any agency who are involved in health delivery in Hackney. So there's already very strong work happening within the Homerton, but Homerton have really embraced the offer of, for example, more co-located staff, more staff training, more case consultation provision, and a much closer joined up working than already exists. So yeah, that work is definitely being taken forward with our health colleagues, and who are, I find, very consistently positive and up for service improvement.
Thanks, Cathal. Thanks, Cathal. I did just want to check that that might include community pharmacy in the health settings page.
Sorry, yes. I have, yes, sorry. I have made contact with, not with the community pharmacy. I was given a contact in the pharmacy sector in Hackney who I've made contact with. I haven't yet heard back, but I can follow up outside this meeting with the community pharmacy sector as well, because I'm very keen to include all pharmacy type distribution in the training and case consultation, promotion of case pathways and so on, so that they too can feel as integrated as any other partner in Hackney.
That would be great, and I'm sure from the diary invite, if you don't already have it, Raj's contact details are available. I'll bring Councillor Jana. Is that okay, Raj? That you took your hand down. Great, thank you. If you want to put it in the chat as well, that would be fantastic. Councillor Jana Thomas, I'll give you a brief right to reply.
Thanks very much. Just want to pick what you mentioned around the nighttime economy and what we are doing. Of course, while we are making the nighttime nightlife safer for or visitors and residents to our nighttime economy space. The other thing we've been doing with Tower Hamlet, we've actually started a periodic training on WAVE, which is the welfare and vulnerability engagement training. So this is to increase the skills, knowledge, and confidence of those working in licensed premises, which is focusing on vulnerability, their responsibility, and how to deal with violence against women and girls in their space. So that is part of why we are doing, and we're doing that jointly with Tower Hamlet. Anyone can attend the training, which we started this month. So just to put that out. Thanks.
Thanks, that's brilliant. Well, thank you, Cathal, thank you, Councillor John Thomas, and the contributions here. I hope that was useful, and that we both highlighted the issue, the work that's happening across the partnership, but also we're able to sort of feedback positively, and it sounds like we have. So, thank you. I will move on to the next item on the agenda, which is community voice. So we have, and there was no decision to take over the previous item, so that's why I've moved this on. Community voice, so that's considering the enablers associated with the Ageing Well strategy. And we have Sally Bevan to present. The report is in the main documents. Again, 10 minutes to present, 5 minutes for discussion and questions. And it also provides feedback, which I think was a previous action around the focus group work for the Ageing Well strategy. There are recommendations in the report as well that we may want to consider. I'm not going to read them out. I'm going to rely on Sally to do that. So over to you.
Thank you. Healthwatch was given the opportunity to bring an agenda item that fit in with the Ageing Well strategy agenda item. We looked carefully at the Ageing Well strategy, which is fantastic, and we felt the thing that really jumped out at us was the set of enablers that appears in that strategy, because going right back to basics, if the enablers aren't working properly, how can that strategy keep moving forwards? So we elected to bring together a small group, a group of 8 local residents, to do what we've called it a focus group. It was quite an in-depth, it was an afternoon we spent together. It wasn't a quick 45-minute focus group. We thought quite carefully, we considered doing a survey and going out to a much wider number of people. I'm quite hesitant to go back and survey and ask people questions that I feel they may have already been asked, because I think people just get really sick and tired of thinking, we've already asked how we want to be communicated with, how we want to be engaged with, and potentially at the creation of the Ageing Well strategy, those questions were asked. So we felt it was more appropriate in this case to have a really in-depth discussion. We brought 8 people together. They were 4 women and 4 men with a good mix of ethnicities. 2 of the focus group attendees have been involved already in the creation of the Ageing Well strategy, and 2 of them represented the Old People's Reference Group. So we had quite a good mix of people in the room. The enablers as listed in the strategy that we spoke about are...
Just Sally, do you want someone or do you want to present the PowerPoint, or you... I wasn't sure whether we were expecting to go through it, or you just orally...
I'm quite happy to talk through it, or would you prefer to have it on the screen? I know it went out with the pack.
I'm agnostic because I have the privilege of seeing it in front of me, but I'm just thinking colleagues that might not have got their way. But let's carry on as we are then. But just to say to colleagues, it is in the pack, and it's fairly obvious from Sally where we are in the pack. So I'll hand back to you.
Okay, thank you. So the enablers as listed in the strategy that we discussed is older people's continued involvement, joined up working, communication and information flows, Hackney, a place for everyone, and shared approaches. And as we spent time with our focus group attendees, some of these themes really emerged as the areas they'd really like to focus on, but we will touch on each of those themes. So we spoke at quite length about older people's continued involvement, and we had some quite positive comments about things that are going on at the moment, places where the people we were talking to feel that they are being involved and work is being done and they're being listened to. They felt very, very positive. So we particularly heard about some kind of grassroots work that was going on, working with Age UK has felt positive, spending time with dementia awareness sessions. And they really spoke about times when they've been able to meet with counsellors and come together and feel very listened to, and that feeling really, really worthwhile. So, and they felt it was very important to say, we want more of that. We want to have that chance to be listened to. We want our voices to be heard. There was an acknowledgement that from those that had been involved in the creation of the Ageing Well strategy, that I think we talked about kind of the staffing issues that had gone on there, that there was someone that was absolutely fantastic in that post that was driving it forwards. So they were aware that it had been a bit of a pause. They were very, very keen for things to move forward. And that wider kind of message from the older people we were speaking with is it's so apparent that often there's one person that can drive a piece of work, and how to keep that continuity going if that one person moves on. Older people told us that they would like to attend sessions and stay involved, but and this is really for all of us to think about. The way that those sessions are planned, that needed a lot of careful thinking. We heard from people saying that we've come to sessions, different sessions, kind of workshops, co-production sessions, and not gone again because maybe English is our second language. Many of us are a little bit hard of hearing. Sometimes it's as simple as thinking about asking in advance. And if you know people are hard of hearing, thinking about where they're sitting in the room so they can hear more clearly, thinking about translation, thinking about speaking more slowly, making sure that there's easy read documentation. They were saying, just think about who you're inviting to a session and make sure that you're setting it up in a way that people feel really comfortable with, have frequent breaks, make sure there's tea and coffee, all of those back to basics kind of things. They told us that it's very, very important for them to feel involved in a way that works for them. They felt that often almost you sign up for something, you say, oh, I'm really interested, and the system, the various organisations in the system will go, great, we've got a new volunteer, right, okay, we want you to come to this, we want you to come to this, we're sending you an email, we're sending you a whole load of paperwork, what do you think of this, can we have some feedback? Felt quite overwhelming. Not everyone wants to be a member. We want to be heard is what we were listening to and being told. We want to be given the opportunity to share our opinion, to share our experiences. For some of us, that means really being involved in starting to shape services, shape strategies. For some of us, it's just a chance to come along and say, this is what my experience was. Can you take that away and make improvements based on that? So really find out what people have got to offer, and don't make assumptions that because somebody said, yes, I'd like to be involved, that they're going to fit into the box that you've laid out for them, and just carry on doing exactly what you need to do. One of the really interesting things that they told us was, we've got a lot to offer, but don't assume that what we've got to offer fits into the box of what it is that you want us to do. Why don't you make it more co-productive, more collaborative from the start, and allow us to come to you and say, this is what we've got to offer, this is what we think we can do for you to shape the work going forwards, rather than us saying we need someone that can do this. So that was quite interesting that came out of that conversation. We spoke about joined up working and shared approaches. They're two enablers, but the group we were working with really considered this as kind of one topic, and they particularly talked about it in terms of the way in which they're enabled to take part in shaping decisions, shaping services. And what they were told us, which I found very interesting listening to the group, was there's so many different departments and groups. It's not always clear whether you're engaging with the council, the NHS, Healthwatch, or someone else. It really needs to be much, much clearer. Who is it that's asking for our input, for our feedback, for us to come and co-produce? We don't really know who we're talking to half the time. So what they were telling us was to be really meaningfully involved. They'd like to understand the function of all of the different organisations. And they spoke about breaking things down into bite-sized sessions. They were saying to me, Healthwatch does quite a lot, for instance, because I was talking on behalf of Healthwatch. We would love to have sort of a 20-minute, half an hour session talking about this element of what Healthwatch does. So, for instance, let's learn about Healthwatch and signposting on one session, and then we can learn about Healthwatch and the opportunity to co-produce on another session. And could we do that for the different organisations that are involved? So, where is it NHS? Where is it local authority? Local authority's got so many different departments. Who we'll be working with? What are we being asked to do? And then it really came out listening to them, even just from those people that were in that room. We had people saying, well, I'm here representing the Older People's Reference Group. And then somebody else saying, I'm here because I've worked on the Ageing Well strategy. Someone else saying, I'm here because I've been connected to Healthwatch. And all saying, I didn't know that your bits even existed. So where is that kind of link up? If we're working with people, how are we failing to say to them, if you're part of the Older People's Reference Group, have you also been part of, or are you aware of the Ageing Well strategy? Do you know what Healthwatch does? Do you know what HCBS does? How are we linking all that up and sharing that so that people understand all of the different parts, how they link up, and then they can make, what they were telling me is they can make the choice then and the decision to get involved with part of the system that feels right for them, rather than the part of the system that they just happen to stumble across. That was interesting. And communication and information flows. Communication, I would say, was probably one of the overriding themes that came out throughout the conversation with the group, even though it feels like it's probably the same conversation that we have over and over and over
Sorry,
again.
just conscious of time, Sally.
Oh, sorry, I'll move it on. Yes, yes, they told us really think about methods of communication when you want to involve older people. Think about, don't just send us a long email. Look at all the different ways that you can communicate with us. Look at flyers. Look at word of mouth. Look at writing letters. They told us that there needs to be a balance of different ways to share information, but crucially ask people, how do you want to be communicated with, and listen to what they're asking you. And last slide, and then I'll move on to the recommendations. Just to say, jargon, it always comes up, it continues to come up. All of the people in that room said we haven't been in a single session where we haven't felt that there's jargon. After a while, it makes us feel as if we are stupid because we don't understand what you're saying. We can't keep asking, and then we stop engaging, and we're not going to want to continue to engage with the system. I'm going to move on because I'm conscious of time to the key recommendations that came out of that session. I'll share them with you. I don't know whether they're recommendations necessarily for this board or things that can be cascaded down for people to think about within their organisations when they're engaging with older people. But the key things that came out of the session, they asked if we could consider designing bite-sized information sessions about the functions of each organisation. They said they would very much like to see a newsletter or a magazine designed to keep them informed. They believe there used to be one, but that doesn't seem to be in circulation anymore. They want messaging to be coordinated so different organisations share information about each other. More careful planning of events, forums and communications to ensure that they're accessible. Organisations should refer to and utilise the City and Hackney Co-Production Charter, which we spoke about at the session, when organising involvement activities. Ensure older residents are offered a choice around preferred methods of communication. Ensure communications are clear, jargon-free and multilingual, and offer older residents the opportunity to get involved without dictating what that looks like.
Brilliant. Thank you. Really clear and really clear on the final slide in terms of key recommendations. We obviously have many of the people involved in the Ageing Well piece of work here and in the next item. So I hope they sort of heard these points as well. Do we have any questions or comments? One bit that I had from the chair, I just wanted to highlight a couple of little bits, was the City and Hackney co-production charter. Is that the systems charter for co-production? Is everyone on this call signed up for it? And is that the template that we all use, or are we all working on our own charters and different ways of doing co-production? I think the newsletter's the Connect Hackney thing that we sadly lost with the funding probably, but there is a consultation that has either just closed or underway on Love Hackney. And I guess there's a question there about, are older people accessing that new format? Because the reference in the report is obviously to Hackney Today, which we no longer publish. Is it about having a page on that? Does that feel what people want? Is that patronising? Or is it, how do I think there are some signposting in the magazine, certainly in the listings for older people, but that's something we might be able to fix relatively easily. And then I did pick up the point about multilingual communication, which has been a topic of some conversations today. That's enough for me. Anyone else want to contribute? I've got Councillor Kennedy in the room, and I've got Sally in the room. So Councillor Kennedy.
Thank you. Yes, I'll keep it brief at this stage, Chair, because I'm conscious that actually once we've heard from Sonia and her team about the developments in the Ageing Well strategy, then actually we can take everything as around and answer some of those questions that are laid out for us, I think, at item 9. But I think you're right, that newsletter, it was the Connect Hackney one, wasn't it? And I hope the answer does lie about us using Love Hackney properly and better. Essentially though, thanks for the presentation. I think most of the problems there that we're talking about, they're good problems to have. Like, so many organisations are trying to get in touch with us and work with us that we'd like to understand more clearly who they are, and we'd like not to be overwhelmed with those requests. Is a much better place for a system to be in than nobody ever talks to us. Yes, they're problems. I'm really glad you're raising them, but I think they're the right kind of problems to have. I think I'm glad that the system is throwing up those kind of challenges for older people, rather than neglect and them not feeling involved at all. Thanks.
Thank you, Councillor Kennedy. Susan.
Thank you, Susan Masters, Hackney CBS. The magazine that's being referred to, I think, is Hackney Senior, and one of the great things about that was it was written by older people for older people, so it was topics that were of interest to them, seen through their eyes as well. I would echo a lot of Sally's points. We're just at the moment going through the third set of in-person neighbourhood forum meetings, and a lot of the issues that she's picked up, we've picked up in terms of presentations that just aren't appropriate for the audiences, too much sort of jargon, and we're thinking about actually working with Healthwatch, organising sort of communication training for statutory partners who want to sort of present for those kind of audiences. And I think the only other point I wanted to make is we had quite a detailed conversation at the Hackney Downs Forum about communicating with the elderly and how you get a message, which is, the $1 million question. And we were thinking about having targeted communications around sheltered housing, around estates. And also one of the other challenges we were thinking of is how you have social connection for people who are housebound, and whether you could have some kind of a service that actually took coffee mornings to people in their own homes. Yes, I think those are my main points. And then the only other thing is just in terms of the Ageing Well kind of older population of over 55s, just remembering that a lot of those people are still in work, so maybe aren't being reached by these kind of activities at the moment, and whether there needs to be more activities sort of going on in the early evening to sort of target that particular cohort.
Thanks, Susan. I would make a big pitch for the community library service in that point about taking stuff to people's homes. Probably one of the most extensive and powerful, and maybe if we aren't signposting there in terms of jigsaws, board games, videos, DVDs, magazines, e-sign up, books. I think over 800 residents already engaged, or certainly at peak. So if we can do more through that, that's already there and already trusted, then that would be really powerful. And if there are materials that the voluntary sector and health sector want to use through that service, I think that might be also really, really useful. I don't know, it feels like we really welcome the recommendations. We will take them definitely away and embed them. And maybe if there's anything missing, Sally, from the next presentation and just feeding in, that's the best way to sort of take it on and note it. I do just want to go back to the housekeeping bits now we're corporate, because it'd be very, very easy for me to forget everything that we should have done at the start of the meeting. So is the meeting happy to appoint the BCU Commander James Conway to the Health and Wellbeing Board formally?
Yes.
Yes, brilliant. Thank you, everyone. Are we happy with the draft minutes of the meeting of Thursday, 26th of January?
Yes.
Yes, brilliant. Are there any other bits that I've missed, Peter or Mark, from the start? No, fantastic. So after that small interregnum, we will move straight on to Anna, who's online, and Sonia, who's in the room, about the Ageing Well strategy. Is there anything, Councillor Kennedy, you just wanted to overlay, or are you going to come in after the presentation as the lead member?
I hope it's going to be mentioned, but right up front, I did want to pay tribute to Councillor Maxwell, who, before she had to step down from the post of mayoral advisor for older people, led so formidably and excellently upon this work. And also, alongside Soraya, and actually, Sally, you referenced it, to have, we have to be careful now with this work, that with that political leadership and that lead officer role both having gone, that we as a system managed to keep it up. But actually, I've seen from Sonia's paper that she's laid out very well how she's planning to do that on the officer side. And certainly, I'm taking up that baton that Councillor Maxwell has passed on. Thank you.
Yeah, indeed, there is no diminishing of the political commitment from myself and Councillor Kennedy. Well, absolutely thanking Councillor Maxwell for her work. It will not be lost within broader portfolios. And I know, as the report says, the update says that the resourcing around that is in place. So I'm told by the briefing that Anna wants to come in first, and then we'll come back to the room with Sonia. Is that correct, Anna? And we've got the presentation.
Great.
Fantastic. Over to you, Anna.
Brilliant. Thank you, Meg Lanville. For those of you who don't know me, I'm Anna Garner. I'm Head of Performance and Population Health for NHS NEL, and I co-lead the Population Health Hub. We came to the Health and Wellbeing Board last year to ask members really how we support you to think about health inequalities and population health during the work that you're doing, and during your appraisal of the items that come to the Health and Wellbeing Board for discussion. And so I wanted to try something really in terms of a set of prompts that are kind of elements that members might think about during Sonia's presentation as a bit of a trial. So they're listed later on, sorry, I think page 84 of your pack, but they are things for people to think about during Sonia's presentation, and then we're going to have a discussion afterwards about whether they were helpful for members in terms of letting you think about things that you might not have thought about, and taking the discussion more towards a kind of inequalities section. So in summary then, they are around thinking about what dimensions of inequality relate to an item, and what are the intersectional considerations, i.e. what are the intersections between different elements of inequality that we're thinking about here, and have they been considered within the presentation? Do we have defined plans around addressing these inequalities? Are there any ways in which this work might unintentionally widen inequalities that have either been highlighted or not highlighted within the presentation? And how do the focus areas of the health and wellbeing strategy, so mental health, financial security and social connection, relate to this item? and what items could be, what actions could be taken to maximise the positive impacts and minimise the negative impacts on health inequalities within the space highlighted by this presentation. So if there are things that you could bear in mind, and then I'll hand over to Sonia for the rest of her presentation.
Thanks, Anna. And thank you, Sally, and thanks to the 8 residents for their feedback, which I'll try and do justice to as I go through the presentation. So can I just check the time I've got? Is it 15 minutes? So, so I'm going to start by briefly introducing the written report and then move to the presentation, which is going to go through the 3 areas that I've drawn out for discussion today that are summarised in the report around preventable conditions, social connection and financial security. So just by way of background, Hackney adopted its first Ageing Well strategy in December 2020. We're obviously finalising that during the pandemic, and we were able to take on board the impacts of that, which then continued to accumulate and become worse as we went through the first stage of implementation. And Hackney also passed a motion in 2021, so there's political commitment as well. The focus to begin with was developing the group of residents who are going to continue to support the implementation of the strategy, and we have a 40-strong group, most of whom are pretty active. We hear from a range of them. The point that you made about connection with other groupings, Sally, the idea is to have resident representatives and then people who come from the Older People's Reference Group, Connect Hackney, and so form a committee that brings together residents who've never really had anything to do with, formal projects in Hackney, with those who bring that institutional memory. But that is something that we can continue to develop, and I'll come on to the development of working with that group of residents in a moment. So, since the Ageing Well strategy has been adopted, it's also important to say that we're in a new administration and a new strategic planning cycle. And as has been said, both the corporate and the political commitment has only been strengthened by the both the manifesto and also then what's reflected in the strategic plan. And the report goes through the ways that the Ageing Well strategy has directly influenced the shaping of the strategic plan. And the members of that Hackney Old Citizens Committee, about 15 people in total, had the chance to sense check the strategic plan and shape the final version, particularly focus on social connection. We also had, we secured £250,000 through Department of Levelling Up to be able to develop a locality-based response to Ageing Well that facilitated closer partnership working between council services, health partnerships, particularly neighbourhoods and community organisations. And I'll be sharing some of that insight and the update weaves in how we've been able to look at implementation of the strategy in a local context. The residents have talked about the difficulties around staffing. I don't think it's about the individual Soraya who originally drove the strategy was fantastic, but I don't think the issue is that is about an individual. I think the issue is that since then, she left in July. When I replaced her post, I had to prioritise a focus on supporting refugees and migrants and poverty reduction and cost of living. I had no choice but to do that. And since then, I spent a couple of months trying to build together the resource to create dedicated capacity, because I believe that this needs dedicated capacity. It very much is evident from the way that Young Futures were able to develop and shape properly. I have got Simra on the call, whose time has been prioritised from within the strategic delivery team. So for the last couple of months, she's been working half of the week. And I also am about to firm up some recruitment, which should mean that we have a post and a half in place for April. So the report highlights, it draws out the main highlights, but I recognise that I need to come back, and I've said to Simra in about 6 months' time, so September, to be able to go through a more systematic progress update on the report. The priorities for that team will be putting time into working with the group of older people, and putting more time into those who need more time, looking at the gaps, and really starting to develop that way of working together systematically, driving the actual strategy. So this is the bit that Simrat's already starting to do a lot of, is working with different teams across the council to look at where we are and what else we can do, but in a collaborative way. And then moving on to building a partnership of community organisations who can help us under an Ageing Well banner to really look at working together, looking at the gaps, fundraising if needed, but also critically looking at how we how people do engage, and what are the best ways to share that information, which often is word of mouth, and also really understand that. So linking information and engagement with actual participation in activity. So if I move on to the presentation, so I will go straight to the topic. So just the older population in Hackney, just to say that it's proportionately more older people who are white, British and Black Caribbean. So it's got a different demographic. We're waiting for the latest census data on that. And a large proportion live in social housing. And a higher proportion are looking for work in the over 50s group. And this is a group who in Hackney face difficulties financially. So there may be an assumption sometimes that of the baby boomer generation, or that people are financially comfortable, they're homeowners, but that's not what the story in the borough. So focusing on 3 areas, looking at ultimately the difference we want to make is in preventable death that's linked to preventable conditions. So then if we break down the different areas that the Ageing Well strategy highlights are needed in order to engage people in community settings to address that. It's about physical activity, it's about healthy weight, it's about managing those conditions or preventing those conditions, through that. It's about recognising the relationship between caring responsibilities and impact on health, the wider determinants, which are also recognised in NEL's plans, and then recognising that some groups will start to age earlier, so people with learning difficulties, for example, and also dementia. So then what I've done here, and I'm not going to go through line by line, is I've pulled out the intersectional issues, because then that will help us to have a discussion about how we make sure that people, particularly from these sections of the population, are engaging in physical activity, are being their conditions are being picked up through early screening. And the question for Ageing Well is always, what's the community offer here? How can we do community-based activity that then connects with the clinical support? So, so the question for you is, how do we encourage thinking about ageing as a lifelong process, but going back to where we want to affect change in those different areas? And from the report, I'm sharing that there's the Partnerships for People and Place work, which is helping us to demonstrate how community activity can better support Ageing Well, and we'll have the evaluation later in the year for that. There's the Kings Park Moving Together, and work that's just been commissioned, looking at the whole system and how we tackle physical activity, and an opportunity to focus on older people, a key group seen in the slide before, that the group that are less likely to take physical activity. So how we can look at that. The point about carers and the link to carers and Ageing Well, the Old Citizen Committee will be keen to contribute to shaping the commitment that's there in the manifesto and planned around supporting carers. We've made links with Noel's programme lead for Ageing Well, and we're also participating in a research programme that's been led by King's College, which again goes back to really where we're getting to is how can we think about this? The focus is over 50s, but how can we think about it for all ages? The financial security side, so as I said, this is a group in Hackney who are more likely to be in financial difficulty or low incomes. We're concerned about a group of 50 to 70-year-olds who've become economically inactive in the pandemic across the country. And our claimant count is particularly high. And just thinking intersectionally again, inequalities are exacerbate as people age. There's a link to an evidence card there, and age discrimination is also compounded. So if you face discrimination because you're from a black woman who we know is statistically will face discrimination, then they will face greater age discrimination. So emerging solutions, we had a session with older people, DWP, central government, and there are a number of solutions which we need to work with health partners on, and Nina Griffith and I co-chaired that session, and we're following up with DWP about what we can do next week, working with the employment and skills team. But it is very much speaking to solutions that are about thinking beyond employment and skills, so bending programs that exist already that are more in the health space, looking at the multiple challenges older workers face, linking to economic inclusion, so the health and wellbeing strategy, priority back financial security, so understanding the need to have debt and benefit advice. And I think what really came out very, very clearly from that session, which maybe is different from even when we might have looked at this 5 years ago, is how the world of work has changed. I think that's changed even more quickly during the pandemic. And so needing to have support that is bespoke for people, but also that respects the experience, skills and needs of older people. And often they say that it can feel like a younger person's offer. So final slide, 2 slides about social connection. I think the point I want to make here is, and I've linked up with Joya, who's I know got a report today as well, is recognising that social connection needs to be thought about every time we design or commission a service. It's the Connect Hackney learning experiences, the importance of socialising, coming together, not the out, if they will not come because it's good for their health, or why would, I don't, it's like, think about how people live their lives and why they come together, and then build in the aspects which are going to benefit people in that way. So although social isolation can affect people of any age, it's much more common in older people. We do need a focus that looks at the specifics of what that means for older people, and how that's associated with risk of death, and think about the specific groups that I've cited here who are more likely to say that they're lonely, and think about the way Hackney's changing as well, and that social change that then means people may become more isolated on the street as the demographic changes, their family move away. So in terms of what we can offer, very keen to continue to work closely with Joya and team, but there's a work that Culture have led, which we're now going to develop further with the Hackney Older Citizens Committee. There's what I've talked about, having an ageing well network, which brings together organisations. I've reached out to Hackney CVS for obvious reasons. It's the legacy of Connect Hackney, and I want to work with them on it. The intergenerational activity, really trying to maximise the benefits of that, and we've mapped all of the activity so that as part of the new network we can have a focus on that. The importance of locality-based activities, this came out in the Ageing Well strategy and has been reiterated, but I think the investment we're making through partnership with people and places is helping us develop the understanding of what's needed, and the Older Citizens Committee will be keen to influence that work directly as well. So I'll stop there and welcome questions.
Thank you both for that. So the discussion is a sort of the 9th item on the agenda, and the questions are in the chat that sort of Donna's put there. There was still quite a lot in Sonia, in your presentation, and I think really positive how we're taking forward the strategy, but that piece around employment. We've, for people that, not everyone was part of the census conversations earlier, but there's a lot in there as well, if people that are watching are interested in the statistical backdrop to some of these discussions. I think there's my just initial thoughts are there are lots of different lived experiences of ageing in Hackney, and that comes across really vividly in this and the experience. If you're part of that network of people that are accessing services, new age games, the community-based activities, lunch clubs, stuff like Posh Club, I spoke to a group of older people that said this is literally the best place to grow old. I talk to friends and family that live outside London. I talk to people that leave Hackney and go to other places, and there really isn't that rich red vein of activity that is available for free, that's advertised, and is also, directed all towards our diverse communities and led by them. But then everything you said, Sonia, about what it is like to lose your job, lose that income, be in poverty, be in the private rented sector, older, have life-limiting conditions, growing old with LD. There's a whole range of things there, and isolation that's been sort of highlighted. So it's really hard to ride those two, all of that need, and still have that sense when you talk to some older people that it is the best place to be. So a lot to do, really. The one message they had for me was don't stigmatise us. So it does come back to language and agency, and I think you said, Susan, as well, people don't want to go to a stigmatising project, and seeing themselves leading that came across very clearly as well. Before we move into that sort of structured discussion with Anna, did anyone else have any sort of immediate thoughts back to Sonia's presentation? Susan.
I just want to say how positive I found the strategy regarding ageing as a sort of lifelong process for a start, and also the work of Hackney Circle, which I think has been absolutely amazing. Because I think too often with life, you start off as a child, you don't have a lot of agency over what you're doing, you become an adult, you sort of determine your identity, you have all these interests, you choose your friends, who you're going to spend time with, what activities you're going to do. And then as you get older, you lose that. And one thing I like about Hackney's approach, and it does seem to be pretty unique, is that they preserve that. They don't have, I don't get the sense that you have activities that are specifically for the elderly. I love the idea of Hackney Circle, that you can get in touch with them and say, well, I'm really interested in this particular activity, and they will sort of direct you to a group which is not a group that's aimed at elderly people, but that is friendly and accommodating and inclusive of that category in terms of their needs.
Thank you. So the more, I don't take anything away from the content, the more structured points were in the chat around, Anna, what did you want out of this bit? I know you spoke before, Sonia, but just in terms of directing this area of the item.
So this was really then to say to people, what were those, how did people use those prompts in thinking when Sonia was presenting her item? Were they useful? Did they prompt thinking that people wouldn't have had without them? And either way, really, were they helpful or not? And is there anything else that we could do to support Health and Wellbeing Board members around considering inequalities with the work of the Health and Wellbeing Board?
Thank you. So I saw Dr. Husbands and Councillor Kennedy put their hands up. One bit of thanks, I think, is actually framing the presentation in terms of the priorities of the Health and Wellbeing Board. I thought that was quite powerful in how you closed on it. So a lesson for everyone here. Dr. Husbands.
Thank you very much, and forgive me, I don't have much voice, but it was a really excellent presentation, and I do think it's really helpful to frame it in the context of our priorities in that way. I think just to add to what Anna was saying, what we were trying to do by giving these question prompts was to help us as a partnership, not to just receive a presentation and say, oh, isn't that great, and Sonia can go off and do her work, but to say, how do we collectively, in working through this strategy or anything else that comes here, start to really embed reducing health inequalities as an outcome, and taking into account those areas in which dimensions of inequality or discrimination interact. And Sonia presented that really well actually in her presentation, where she's looking at the intersection between age and ethnicity and disability, for instance. And so just understanding that, so that that then helps us to think differently and drive the work that we do collectively, is really what the purpose of these prompts are. And what was really helpful, really powerful actually, about when Sonia was presenting an aging well strategy, is I was just thinking, actually, you could have said much of the same thing about the way we work, and it actually applies to what Susan was presenting in terms of the community voice as well. With almost any group that we have defined because they share characteristics, whether that's because they all have learning disability or they're in the same age group or the same ethnicity, that they don't want to be treated as though they are something on the margins. They want to be heard. If they volunteer their time, that doesn't mean that they're giving us their entire, signing over their lives to us, but they also are rounded people who have many characteristics, and not just the characteristic of the group that happens to align with the particular strategy we're looking at the moment. So it's actually, I thought it was really helpful just thinking, if you just apply all of this, say, how do we help people to age well, that also helps us to achieve a lot of other things for our population.
Thank you. Thank you, Dr. Husbands. I think that so much in there that I just agree with. I don't want to waste time picking out all the bits I agree with, but it was a lot there that really made sense to me. Councillor Kennedy.
Thank you. Yes, a really helpful and useful, Sonia. I wanted to pick up on two things. One is about the stigmatization, especially it's something we were talking about when we were talking about the poverty reduction framework in a meeting we were in yesterday, and very specifically talking about how we co-produced. And we did want to invite members of the community who are receiving pension credit, for example, to a session about how we destigmatize the reception of credit and benefits, because we know it's a barrier for many people in accessing them, or indeed even wanting, with the help of someone else, to fill in the forms. But as we said then yesterday, the last thing you do is invite someone to a destigmatization meeting because no one's going to come. And how you actually co-produce that. And to answer your question earlier, Chair, we did all sign up to the same co-production charter. I'm pretty sure of that as a board, and we are all committed to those ways of working that don't assume everyone interacts in the same way, and that actually you have to be discreet. You have to look at how people respond best, but at the same time give them a chance to stand back and not be involved if they don't want to. All principles like that we are all signed up to, and it's right that we should be talking about ways of how we provide services, consult people in the way we provide services to them that doesn't label them or stigmatize them. That was the first thing. And the second thing, I just wanted to draw out the point about carers. I forget the exact figures, but it's something, we think there's something like 7,000 unpaid carers in City and Hackney, and we think we only actually know or could get in contact with about 2,500 of them, because it links into the earlier point about stigmatization. Lots of people don't even realize they're carers. Some people have been carers for years before they would even consider themselves as carers or apply for attendance allowance or anything like that. So I'm really pleased that in September we start serious work on our carer strategy. And we had an event for our unpaid carers at the Tomlinson Centre a couple of weeks ago, where I went and said to everyone, not just thank you for being a carer, but we know you're there. We know there are people who haven't come today because we haven't been able to invite them because we don't have the contact details for them. But part of our carer strategy will be how we identify that community better. And that's where we'll start genuinely unpicking those health inequalities that undoubtedly unpaid carers suffer from. Thanks.
Thanks, Councillor Kennedy. I'd written down carers, so you raising it here, I think, is exactly what I was going to say. The only bit I would add to that is thinking about where you've got multi-generational older people households. So you have a much older relative with a person that's always lived at home, who, you know, and there can be all sorts of reasons for that, LD, support and care, the housing crisis, and what happens when that older person who may have the tenancy passes away, and then the person that's left behind, you know, they can be isolated as hoarding. There's all sorts of things. I don't want to stigmatise it. It can be a flourishing household, but it presents quite a lot of problems, I think, and the housing crisis is exacerbating some of that in the context of sort of caring. And the question 3 about widening inequalities unintentionally, I still think there is a risk of we're talking to the same people. Come back to Sally's presentation, that there's a group of very articulate, very well connected, very passionate older people in the borough that are influencing policy in lots of different ways, and they may get fatigued by that, absolutely. But how do we, through this work, expand our reach? And whether it's into carers, whether it's into other protected characteristics and intersectionality. But I think that's something that we should always be looking to do. And the people that are providing many of these services, you know, again, the lunch clubs, they want more people to come through the door. They're really eager to reach, and I think that expanding reach is something we should all be thinking about. And then the benefits slide, or you referenced pensioner credit in the presentation, and you have, Chris, we know that's work that Money Hub is doing. So just to make sure that is referenced, I suppose, in that work, because while we may have high levels of pensioner credit, actually in terms of take up of people eligible, we're still saying that the levels are low. That's enough for me. Just on taking the conversation further, there are a lot of partners that are not here or not engaging in the conversation for various reasons. Is there any follow-up, Anna and Sonia, that you want to do through the kind of membership of the board to make sure that these questions are actually reached by the people that are sort of half in, half out of the meeting, or haven't been able to come today because we're a little bit light? Anna and Sonia.
Well, because this links to what's in the Ageing Well strategy, it is the work that Simrat's been doing, is to go through the commitments in the Ageing Well strategy and reach out to people. And there's a health and wellbeing section, so that is very much about health and wellbeing. You know, people from the health partners who'll be on this call. So if you haven't been contacted yet, it's just because she's working through in quite a systematic way all the different conversations we need to have and getting those started. So I would suggest that that's probably the best way to approach that, is through that systematic engagement. And then when we come back in 6 months' time, there'll be more of an opportunity to properly sense check whether we've not been able to gain traction, you know, in any of those areas, or the whole isn't making sense. It's just still you know, it's not the whole isn't greater than some of the parts. It's just still the individual activities that are going on. So I think that's the best way to respond to that. I mean, I think a key message, just to reinforce what Sandra said, is that, as I've put in the slide, really Ageing Well, we need to have a focus on over 50s and over 55s. You know, we need to make sure that the experience of people now of that age group is better. But at the same time, if they think about Ageing Well, it has to be about people recognising the key health inequalities that we're all grappling with are the ones that are going to help people to age, you know, that tackling those would be the ones that help people to age well. And therefore, the key intersectionalities that are pulled out are the key intersectional issues that we're looking at across health inequalities. And so for people to just really think about that actually, if you're more focused on tackling health inequality in your day-to-day work, you will be more focused on making sure that people are able to age well, because they're able to live live healthily.
Thank you, Sonia. Powerful point to end on, something that was very aligned with what we heard at Power Pride as well, about older LGBTQ plus people and being able to be themselves in and have a supportive kind of society around them that supports people to age and not assuming things about them as well. I think that was sort of taken across. So I'm going to end the discussion there. There's no other hands up. A really rich discussion, and I think the three kind of aligned topics really worked well this afternoon. So the next item is, bear with me, is the Health and Wellbeing Board Strategy Update, which is Joa and Andrew.
Thank you, Mayor Campbell. Hi, I'm Joya Desama, consultant in public health, and I co-lead the Population Health Hub with Anna. And for this item, I'm kindly joined by my colleague Andrew Trathan, who's online, who's also a consultant in public health, and he's going to present the mental health aspect. So this agenda item is an update, so it's presented for information on actions that have been taken to implement the health and wellbeing strategy. So I know we've got 10 minutes, so I propose we just do a brief verbal presentation and then we'll take questions. So the Population Health Hub, which I co-lead, have been tasked with coordinating actions to implement the health and wellbeing strategy. I know last time in November there was a request for an item to be brought to the board around the work of the Population Health Hub, so that is scheduled for the next meeting. But just to confirm, we're a system-wide resource, so we're a small team, but our role is really to support people across the system to think about what they can do to improve population health. And we do that through a range of undertaking specific projects, but also thinking about wider things such as training and toolkits, for example, that we can do that will support system partners. So just before handing over to Andrew to talk about the mental health aspect, I just wanted to preface the work that we're doing around sort of implementing and action plans to say that we're really keen that all of this work really leverages the opportunities that we have as a partnership, the Health and Wellbeing Board, to really add value to systems and structures that are already in place, not aiming to duplicate things, but where there aren't those structures, then thinking about how we might best work to address, the gaps. So I'll hand over to Andrew to talk about the mental health aspect, and then it'll come back to me for social connections and financial security. Thanks.
Great, thank you, Joya. So hopefully the paper makes clear our intentions for moving forward the mental health agenda in the coming months. But just to help explain it in a little more detail, the main message that I think I'd like partners to understand is that this is quite a busy space at the moment. There's a lot of really good work that's been done at the North East London level with their interim integrated care strategy that reflects mental health priorities. We've got the place-based partnership priorities, which cover mental health very extensively across a range of what we refer to as big ticket items. And all of this sits alongside the still current City and Hackney mental health strategy, which is current as of this year. So we identified the need to produce something and move forwards in a way that's very complementary to all this work that's been done and respectful of all the engagement and all of the views that underpin the priorities that have already emerged. So our proposal is to develop a strategic action plan, and that's going to be rooted in a really strong, up-to-date evidence base from a refreshed joint strategic needs assessment mental health chapter. So our work on that's already begun, and we're just at the tail end of scoping out the limits of what that needs assessment is going to accomplish. We've consulted quite widely on that and to refine the questions that we need to be answering. The timeframes will be a little bit dependent on the final questions that we do go for. There's already a lot of data out there. We've already engaged with the public in many ways. And I think, as Sally Bevan raised earlier, it's important that we don't keep going to people asking the same questions. We need to recognise that they have already told us things, but there may still be gaps. So we might need to be doing a bit more bespoke data collection, which to do that well takes a little bit of time. But otherwise, at the end of this, we should have a set of crystallised actions, which, as I say, are complementary to all of these policy documents that we have. showing us specifically what we actually need to do. We can accompany that with a description of any gaps that we've identified and what we call a SWOT analysis, looking at strengths, weaknesses, opportunities and threats for the longer term. I'm happy to answer any questions on that, but I'll hand back over to Joya now.
Thanks. And just to add, there's an existing group called the Mental Health Integration Committee, which consists of system partners that the Population Health Hub would then attend to make sure that health and wellbeing priorities are fed into this. And that would have oversight of the development of this strategic action plan. On social connection, it was agreed at the last meeting that we would convene a social connections group. So each of the organisations that form part of the Health and Wellbeing Board would nominate a champion, and Councillor Kennedy has kindly sent an email out. We are still waiting for some organisations to come back on that, and I am chasing you, so apologies for that, but please do respond. We have drafted terms of reference for the group, and Councillor Kennedy has also kindly agreed to co-chair with myself, and that will be to take forward the draft action plan which came out of a workshop which was held with system partners last year. We were proposing the first meeting to be in March, but actually we've had some really useful conversations with Sonia and others which has invited some challenge around, you know, what do we really want to get out of this group? So we want to do a little bit more thinking, and we're keen to hear from you on further thoughts around this. So that group will meet regularly, and that's an example of where we felt there wasn't an existing structure, and we want to really build on the good work. Many have referenced Connect Hackney, the community outreach, community libraries outreach service. We want to build on good work, but also identify the gaps and opportunities to think more innovatively and combine with existing strategies like the Ageing Well strategy. And then finally, on the greater financial security point, I know many of this group will be very familiar with the system-wide cost of living group and the poverty reduction framework. So just to say that, you know, that work is ongoing. And again, the Population Health Hub is attending to make sure that that perspective around increasing financial security, as well as addressing the current crisis, continues to be raised as important. And I think it's really helpful that so many of the presentations we've heard tonight have been focused around those health and wellbeing strategy focus areas. So I'm going to stop there and ask for any questions or feedback. Thanks.
Thank you. Thank you both. Colleague. Stephanie, co-chair.
Hi, thanks very much for that. I just had a quick question just in relating to the mental health strategy and the action plan. One of the things that is coming up as quite a sort of recurring theme that we're wanting to look at is that interface between mental health and physical health. And I just wanted to understand a bit more whether that will be considered as part of this work, because it's a sort of key priority that is sort of re-emerging.
Yeah, I think that's coming out as some of the key areas that's certainly within the scope of the needs assessment that we're going to be working on. I will make a note of that to make sure that we are covering that sufficiently, and may come back to you if you have anything further to add on that, because we are in that consultation phase of making sure that we are expansive enough. But absolutely, that's already on our radar.
Great, and you're more than happy to link in outside of here to kind of join some of the other work up. Thanks.
Thank you.
That's great. Councillor Williams? Yeah, I suppose yeah, there is a merging need, isn't there? Obviously, from our Turkish Kurdish communities around kind of enhanced trauma, given what the earthquake, and there are obviously good anchor institutions from those communities. I think I haven't certainly been able to kind of personally follow up some of those conversations in the way that I might have liked to, but you know, drawing on Derman and others in the community, but thinking about how we can use the network and our resilience, and perhaps learning a little from that as well. About how we deal with emerging trauma. There's not a place, a conversation, person that I have met that does not have a story. People are being really stoic, but I'm worried about the long-term impact of that, because I could feel some resilience, but really fragile. And obviously, adrenaline gets you through the first first period. So that, and we've got some lessons from COVID, obviously, around bereavement and support. So is that enough? Sorry, no, well prompted. My only question back to both of you is what in terms of the people on the call, members of the board, you mentioned the follow-up that you still want to do. Are there any barriers that people here can help unblock to ensure that this does happen? Because I think I'm personally very invested in this, and I know colleagues are. You clearly both are, and others in the room. But it's just, you know, what barriers there might be.
Andrew, was there anything you wanted to come in with?
For my part, not really. We need to engage quite widely in this, and it consistently feels like we're pushing on open doors. So this is not something where I feel like we have to win hearts and minds. So that feels like we're in a good place to do that. So we will need people's ideas, people's views as we develop things. We'll make sure it's as transparent and communicative as possible. But otherwise, no, I don't think there are any specific barriers that we're facing right now.
Thanks. And from my perspective, I suppose I'm most closely associated with the social connections work. Number one barrier, please respond to my emails. I think everyone actually on this call has, so I'll follow up separately with the other organisations. I think one potential barrier, but I don't see it as a barrier, I see it as an opportunity, is the fact that we don't have any specific funding attached to this piece of work. And so I think, and there aren't sort of specific services that are associated with it. But yet it's a really big priority for people. So I think if the board have ideas and continue to champion this themselves, as I know you do, Mayor Glanville, I think that would be really helpful and supportive of the work. But it does mean that we have to continue to think quite innovatively about how we drive this forward, building on what exists, but also identifying where the gaps are. But also, as Sonia was alluding to in the Ageing Well strategy, how can we use other levers like how we are commissioning services and things like that to think more creatively around social connection. So yeah, watch this space, but do please continue to feed ideas in. Thanks.
Thanks. Sonia, were you putting your hand up to sort of wrap around, respond, and sort of close the item, or to continue? Because I did have one point I was going to raise.
It would be for me to close the item.
Yeah.
So.
Okay. Can I that point very well made about funding. I personally would welcome any business case for any small pots of investment. We're still funding our manifesto priorities. These are some of our priorities. I don't want to make this a political meeting. And it's worth having an onward discussion. There's no money under the desk here, but I think if the right case was made, just London and regionally, so the Mayor's Recovery Mission around mental health and wellbeing and champions and sort of wellbeing communities, I think they're Thrive London, and also the role of the ICS and ICB. Just also, is there anything there about making sure that this work connects with some of those bigger, broader themes that the London Health Boards, the London Vision Health and Mayor's projects? It's helpful if we align because we can draw in some of that external expertise, but also, you know, with Thrive and others and good thinking, there's obviously resource there. Sometimes there's pots of money, and that might again enable community-based organisations to help unlock some of that capacity. But then just back to you and Sonia.
Yeah, thanks. I just had a point of information, because I'm obviously not a member of the board, but about the meeting that you had that was hosted by Hackney CBS with the Hackney Migrant and Refugee Forum. So the issue that was raised about the impact on people's mental health, I did feedback directly to Chris and Andrew after that, just to see what might be possible, but I appreciate they not be. But I also fed back to Jennifer Milmore, who's obviously collecting the understanding for the JSNA, that we needed to make sure that we were thinking about the external factors that indirectly impact on mental health or directly impact. And so that could be, inequality and growing inequality. But also I did talk about global events, and I was thinking particularly about the conversation that you just had. So I think that if that could be part of the way we understand mental health needs, to be able to have the scope and range to be able to understand how these events, because they're likely to become only more common and frequent, unfortunately. If we can do that, then I think we can have a response that can be sustained beyond, beyond this one question. So I just wanted to make that point. And then on social connection, I've suggested that Claire Whitney in my service joins the group, and that's so that the voluntary sector strategy can inform and thinking about not just the grants programme, but the way that we work with the voluntary community sector across the council and the system, that can inform. Sorry, I should be close to the mic. That can inform the thinking about investment. It's not necessarily direct investment, but it's making sure that we're valuing social connection and the outcomes that can have in of themselves when we're thinking about how we fund organisations.
As Chair's privilege to add to that, just on that point about Claire's involvement and the Leeds group, there is something about organisations underneath the kind of key strategic players that do the most work in this area. So Rosemary's just left, and I don't want to detract from Rosemary being a member, but if I think about kind of Core Arts and Mary's Secret Garden, some of those players that are very active in doing this type of work on the ground, making sure their voices are there, not filtered. So that is not to take away the framework VCS role that HCVS has, but just making sure the right people are there. And then I think that builds on Sonia's point about the impact of events. We've become very good here, I think, about capturing in crisis the moment of solidarity and saying the right things and convening. But whether we're talking about the trans community, Turkish Kurdish community, Ukrainians, Hong Kongers, what do we then after that moment has passed land people into once we move on to the next? And that I think is a question for the political leadership. But I then think everything that you've just said, Sonia, about that, there's the impact of poverty that is sort of multifaceted and long term, and then events drop into that. Deprivation, I meant to say, not poverty. But anyway, is that all okay? Sorry, I didn't see, because we were very much in the room, which is bad of me. Sandra, sorry.
Yeah, thank you very much, Barbara. Hopefully this will be last comment anyway, but I wanted to pick up on what Joya was saying about, and you had said about funding, but actually it relates to Sonia's point about valuing the work that we commission or provide grants for or work in partnership with other organisations on already, where our primary driver for getting involved in it was not necessarily social connection, but valuing the work that it does that actually increases and creates opportunities for social connection in the people that among the people that they serve. And that relates to the funding issue in the sense that we can, all funding would be appreciated, but we can think about the way that we're doing things that we're already doing, and also how we measure the impact of those differently, so that and as well as and not just things where there's kind of an obvious social connection outcome, like say lunch clubs, but where there's other work that we do where we could actually simply just think about how we use that work to bring people together, as opposed to seeing people as individual units of work. So a lot of this in the absence of funding is actually about just a mindset shift and ways of doing things differently, but definitely some funding would be welcome.
Thanks, everyone. I'm going to leave it there. with the additional steer from Dr. Husbands. We are almost on time, although I did have a 25-minute cushion, so that is why I should not be allowed to chair a meeting like this that's so free-flowing. Last but not least, and I was worried that we would be timed out, but the update on the JSNA work programme from Deanna. Deanna.
Hello, can you hear me well? Okay, this is just a quick one to update the board on how we're doing in this year's JSNA programme of work, and also to get your feedback into whether these updates are useful or we could change something, provide a bit more meaningful update to you. So this is the first one of its kind, so do let me know if this is not quite what you would like. I also would like to mention that I'm going to start asking colleagues and our key partners whether they would like our input into the next year's work program. So if there's anything that's on your mind, something upcoming, please do get in touch with me so I can put it onto the schedule so that I can plan the work accordingly. And we've got enough staff and resources to complete it. So I don't know if you'd like me to share the screen. I'll do it anyway.
It would not be a presentation if you weren't showing screen, Deanna, I think.
Right. I love a screen share. Everyone knows that. So last year, we have agreed that we are going to look at these topics: sexual health, alcohol, tobacco, cancer, healthy weight, substance misuse, and homelessness. So it was quite a packed work plan. So some of the deadlines needed to be pushed, and we have carried homelessness and substance misuse forward to the next financial year, but work on substance misuse, some of the initial insights work has already begun, and we already have a really good groundwork for that. We also added mental health, as you've heard from Andrew, so that's definitely on the work plan for the next year. So in terms of the topics that have already been tackled, sexual health, the final draft just pending review, so really great work from colleagues drawing on a variety of sources, data sources and resources. Some of the emerging findings you can find in the last column there, and also the purpose I've put, why we've conducted it. Alcohol needs assessment. Some of the priorities that are emerging from the existing work as well have been identified, and you can see them in the last column there. The progress of this work has been delayed slightly, and this is to do with just staff turnaround and people leaving and new people being recruited into the post. Similarly with tobacco and cancer, they are slightly delayed, but the work is ongoing. We have not identified any emerging findings just yet. We don't want to be too quick because we're still analyzing some of the data. Similarly, a healthy weight needs assessments. But despite the slight delay, they're all on track and been progressing really well. And we are moving, as I said, we are moving mental health, homelessness, and substance misuse into the next financial year, and we will be adding further topics. So, like I said, do get in touch if you have anything that you'd like to bring to the work program. Obviously, we don't have any emerging findings just yet, but there's some from the initial work that's been conducted around the substance misuse scoping exercise. And that's basically it. So please let me know if this has been useful, or if next time you'd like to hear a bit more information, or you'd like the leads for each of the individual topics to come and present, or pull together a short report on the needs assessment that they've been working on. Thank you.
Thank you, Deanna. I've got some questions, but I don't want to crowd out other people given we've got 5 minutes to go. So I've got in the room with physical hands, Councillor Williams and then Councillor Kennedy.
Thank you for that presentation. Just got a short question on the work programme, specifically around cancer. I understand from what's written on here that the data is still being analysed, but I wonder if we are going to be looking at rare and less common cancers rather than individual cancers, because rare and less common cancers, if you look at them individually, they're not going to really give you much of a picture in terms of the overall numbers from the 4 common cancers will tell you a lot. It certainly won't tell you a lot about the impact on individual lives of those who are living with rare and less common cancers if they're taken as individual cancers rather than a group of 200 plus rare and less common cancers.
From the quantitative point of
Sorry,
view.
sorry, we're going to do them in a group, Deanna.
Okay,
we're going to do them in. Yeah, Councillor Kennedy.
Thank you, Deanna. It is useful, yes. The one thing I would suggest is when perhaps we've completed a final review of a topic area, then perhaps it would be good to have the lead come and present the key findings. You know, just a quick 5-minute, this is absolutely what you need to know about this area. Thank you.
Yeah, I would concur, and I guess the sort of stats behind and what we're trying to shift. You know, if we're doing that assessment, what do we need to know? What's going to change? What are we going to kind of bring out? And I guess also impact of events. Like if I think about the issue of substance misuse, we've obviously had a backdrop of Project Adder. I have no idea whether we're looking at that area in the context of that, plus our recently recommissioned service. We've obviously got that centre of excellence around reducing harm and street deaths, which we celebrated as a record low. But capturing those sort of moments, those external dynamics, national policy change, and just thinking about some of the topics you're about to go into, like homelessness, are we scoping it out with the services that are leads in it before we sort of go there? Because that data set could be that needs assessment, that data set could be incredibly useful for housing strategy work, but also some of the work that refreshes those strategies for housing needs colleagues. And on cancer, building on Councillor Williams's point, if I sit on the ICB board, everything is about the backlog and how we measure up against that. That's what the centre is saying to us. I've constantly been in there talking about geographical and ethnic disparity. So my big challenge around cancer is really drilling into it and seeing, you know, we all know about the national position around the waiting list, but in terms of conditions, geography, inequality, groups, are people not joining the waiting list? Are their outcomes worse or better? They are starting to change that at the ICB and the data and the presentation and do some deep dives. But if we're doing something bottom up from City and Hackney, can we work with our team to get a sense of what's happening in Hackney's part of the system, but also across the wider North East London? So is looking for those opportunities to collaborate, I suppose, is what I'm asking of. Councillor Fajana Thomas, and then we'll go back to Deanna because we're at time. Councillor Fajana Thomas.
Thanks, Mayor Glanville. I'll be quick. Thanks, Diane. It's just in terms of working together, as you are aware, Dr. Osband is aware, there is the Late Night Levy Substance Misuse Board. And I want to find out how we are linking together, how we, in terms of, as we know, there's been conversation with our lead Richards. I'm not too sure if that has been progressed in terms of how we linking that or not having the substance misuse within the Wellbeing Board and a separate or substance misuse board. Thank you.
Thank you. Back to you, Deanna.
Thanks. So firstly, on the rare cancers, I started saying quantitatively, it's extremely difficult to be analyzing something that is rare and only few people are affected by it meaningfully. So we could try and do some of the analysis on the rare cancers with the social demographic, but with the small numbers, it could be not as meaningful as something that you see in big numbers. It's just how statistic is. But quantitatively, I believe the colleagues have been engaging with, and I will get it wrong, but the Cancer Network and colleagues within the volunteer and community sector to get the insights from the patient's perspective. So it should be really, the way I've designed the process for the GSNA, it should be really a well-rounded process where all of the networks are drawn on in the production of the needs assessment. So the board, the interest groups, key partners. I unfortunately don't know at which stage the Cancer GSNA is in terms of where they are with patient engagement or other stakeholder engagement on the qualitative side. But if that's of interest, I could ask for an update from the lead. Sorry, and that is another thing, because I don't lead on them, I only supervise the production of them. I may not be best placed to answer all the questions. And that kind of also answers the other questions with engagement with different boards and interest groups. So yes, whoever leads on a topic for the GSNA should be engaging with the known groups. If they aren't and you have good suggestions, please do email me so I can pass it on to the relevant colleagues. And I don't know whether in the table I present, it would be helpful to just add the responsible officer's name and their email address, in case people would like to get in touch with them.
Be great, I think, and that allows people from this meeting to then follow up directly as well, but obviously ensuring that you've got that awareness. Dr. Husbands.
Yeah, thank you. Just to add on the rare cancers issue, obviously we do our best to provide comprehensive information that's actionable, but we're always going to be constrained. Just building on what Diana says, where something is rare and therefore the numbers for us locally are small. Not only is it difficult to draw inferences from the statistics, but sometimes we can't present them at all simply because of the small numbers. And I just wanted to make you aware of that. When we're not overlooking things or concealing them, we simply sometimes can't present that information because it makes it too easy to identify people from the data. And then in terms of the substance misuse boards, we probably have to have a conversation outside of the meeting because we're over time now, but Andrew might be able to, who's still here, might be able to give you a very quick answer to that.
I'm so sorry, I did have to step away for a moment. What was the question?
Sorry, Councillor Fajana Thomas was asking about the connection with the Nighttime Economy Board, the substance misuse, well, the Combating Drugs Partnership, and one other which has gone out of my head, sorry. But I'm sure, but you know the relationships, it'd just be...
Yeah, so to just summarise the landscape at the moment, the priority is been establishing a Combating Drugs Partnerships, which should have representatives from community safety, people working on nighttime economy in both City and Hackney. We had a second meeting just this week, and we're currently in the process of setting our strategic objectives and getting consensus around that. And that's timed to coincide with quite a lot of grant funding that's coming online in the coming year. Yeah, I'm aware we're over time, but very happy to follow up with anybody who'd like to learn more about that.
Thanks. And just overlaying that with the point I made about sort of Project Adder and impact as well, it would be really useful to have that. And maybe Councillor Fajana Thomas, if you can send that to Andrew, that would be great. I think we're at the end. I did just want to though highlight, and I think if Mark or Peter can provide it to the team, there are a lot of health-based promotions being passed by full council with outcomes that we want to see delivered by the system, whether it's on rare and uncommon cancers, whether it's on menopause, long COVID and other things. They must be built into the work programmes of the parts of the organisation that are represented at the board, because they have had that high level endorsement of the council and they sit outside the manifesto and the strategic plan. And if we lose too many of them, the fertility one is on the way, And we've obviously had those big public commitments where we're trying to lead that sort of change, and the mental health one. We talked about aging well earlier, as well as anti-racism. So I think it'd be just good if we had that as a reference point, but not a point for discussing now. Thank you so much, everyone. We're only 4 minutes over. Stephanie will return to chair us in June. I think we did everything else. And please do get in touch if you've got any further feedback, either on the operation of the meeting or on future agenda items, to Donna, as it says in the agenda. Thanks very much, everyone. Bye-bye. Oh, sorry, I did want to mentioning that I think it's Susan's last meeting. So thank you so much. And it's great that you're here, because you've also been online a lot during that. I've really appreciated it, and it was good to see you at the front and centre earlier on today. So thank you.